Jane, a 25-year-old woman, gives birth to a healthy boy. All seems well once she holds him in her arms, happy to have given birth to a child. But as the days pass, all becomes rather unwell. The woman begins experiencing anxiety, being overwhelmed, oversensitivity, and even crying sometimes on the third day, this continuing for 7 days already. The doctors did inform her that this is a normal condition called postpartum blues, and it should pass after a few more days. Though, much to her surprise, the symptoms continued for weeks after she was discharged with the addition of others. She began experiencing insomnia, a lack of appetite, starting to lose interest in the usual activities she liked, even losing interest in raising her own child she gave birth to recently. All of this was still being brought down on her with fatigue, anxiety, and she even started to lose weight. She should not be feeling this way, as her family supports her and she has a little joy in her life now. And yet, she even has thoughts of ending it all. But why is she like this? Well, from the before mentioned story, we could deduce that the mother is suffering from postpartum depression. By itself, it is a postpartum mood disorder that affects about 1 in 7 women after delivery. It manifests after a period of a couple of weeks after delivery, but can appear even in the late stage of pregnancy or even a year after it. Now, why does it appear? Well, there's a decent amount of factors contributing to it. The mother had a recently stressful life event, a family history of depression, poor relationships and supportive systems, a bad marital relationship, complications during delivery, self image issues after gaining extra weight. All of these are contributing superficial factors in this condition. Besides that, there is a large hormonal influence. The dramatic drop in progesterone after birth may have a role in postpartum depression. A possible explanation is that progesterone and its cerebral metabolite, known as allopregnanolone, seem to decrease irritability, help with overall emotional well-being, and memory. An unbalance of these hormones tends to lead to the first condition, called postpartum blues. Up to 80% of women suffer from this, and this is a very light version of postpartum depression, the symptoms appearing on the third or fourth day, peak on the fifth to seventh, and are usually gone by the 10th. They include irritability, anxiety, crying, being oversensitive, and overwhelmed, as well as sleep and appetite changes. While most women suffer from this after delivery in one way or another, baby blues can develop into postpartum depression with inadequate care, previous depressive episodes, poor social relations, and economic conditions. Besides that, the aforementioned hormonal imbalances can play a part in it. Now, how do we diagnose postpartum depression? Well, we can use the ICD-10 criteria for the depression diagnosis. From this tab over here, you need to have 5 symptoms or more in the last 2 weeks. From the story, you could tell that the symptoms are present: a depressed mood, loss of interest, in other words, anhedonia, some weight loss, fatigue, insomnia, and suicidal thoughts. The first two ones are necessary for the diagnosis, and the mother would qualify for a depression diagnosis from the story. Besides the ICD-10, there's another depression diagnosis criteria, called the Edinburgh Postnatal Depression Scale. Usually, a result of 12 plus points in this is a good indicator the young mother has postpartum depression. So, now that we know who the enemy is, how do we treat this? Besides receiving more support from family members and friends along with psychotherapy, it is wise to use antidepressants. Some selective serotonin reuptake inhibitors, such as sertraline or Zoloft, from 50 to 100 milligrams can be used, but they should be combined with cognitive behavioral therapy or interpersonal therapy. While taking antidepressants, it is wise not to breastfeed the child, as they could consume them with the breast milk, and children likely don't need those days after being born. This treatment can last for months, and, if the mother is lucky, it won't develop into a persistent depressive disorder. Unfortunately, these two before mentioned disorders are relatively benign compared to the last postpartum mood disorder, called postpartum psychosis. It is fairly rare, manifesting in about 1 in 1,000 women. It can manifest sooner than postpartum depression, with signs of psychosis being able to manifest within days or weeks of giving birth already. The signs could be presented as hallucinations, disorganized speech, catatonic behavior, or delusions. It is very dangerous as, compared to depression, the mother is very likely to harm the child, set the house on fire, and such due to the before mentioned symptoms. The usual risk factors for such a disease is a family history of psychosis, or bipolar disorder, history of schizoaffective disorder, or schizophrenia, traumatic events in the past, a past experience of postpartum psychosis, substance abuse, and medication. The usual symptoms of this condition are confusion, a lack of touch with reality, disorganized thought pattern and behavior, sleep disturbances, delusions, appetite disturbances, a noticeable change in level of functioning from the baseline, hallucinations, suicidal and homicidal ideations. However, these conditions are difficult to diagnose as there is no guaranteed diagnostic method. You need to rule out other conditions causing psychosis, such as hypo or hypernatremia, which is high or low sodium in the blood, hypo or hyperglycemia, same with glucose, thyroid dysfunction, uremia, substance abuse, hypercalcemia, and infection. Most of this can be checked with a general blood count, biochemical blood test, blood glucose, urinalysis, blood urea nitrogen, and thyroid function tests. It can be supplemented with a brain MRI along with a CT for a possibility of a stroke, especially in women with history of pregnancy-induced hypertension, preeclampsia, and eclampsia. How do we treat such a severe condition? Compared to postpartum depression, this is an emergency condition where the mother has to be hospitalized and the infant put into some sort of care. When it comes to drugs, usually antipsychotics, for example, risperidone up to 6 mg per day or haloperidol up to 15 mg per day can be used. Like with antidepressants, if a woman is breastfeeding, it should be stopped. If drug therapy does not work, electroconvulsive therapy can be utilized. Electroconvulsive therapy, or ECT for short, is a treatment that involves sending an electric current through your brain. Thankfully, the prognosis is good. Although considered a psychiatric emergency, most patients respond to treatment and demonstrate fast recovery and remission. However, having one episode of postpartum psychosis predisposes the patient to another episode with a future pregnancy.